Hello everyone! Welcome to the episode 4, season 3 of BridgeAusTV. In this episode, I'll be talking about the registered nurse nominated occupations in Australia, the RN registration pathways, and also the RN skills assessment. Right, so this is assuming that you have already the required points for migration. I have discussed that on episode 3, season 3. Episode 3 talks about the general information about permanent residency visa, which has the points test as well. So you better check that out. In this table, you will see the different specialities of nurses here in Australia. There's aged care, there's perioperative, there's medical practice. So, based on your work experience, you can choose which your nominated occupation is. So registered nurses in Australia usually earns between 55,000 to over 100,000. So it depends really on your skill sets, work experience, and specialty. Registered nurses in Australia, they would require a license. That's why they're called registered nurses. They have to be registered with APRA. Okay, so how do you become registered? So there's two currently pathways. The easier one would be just studying a bachelor's or master's degree in Australia. It can be a 2-year course or a 1-year course for the bachelor's. A master's, usually it's 2-year course. And you just have to study, and then when you graduate, you get an RN registration. So when you get an RN registration, then you can then work as a registered nurse here in Australia. Okay, so that's the easy bit. As long as you pass, you get that. The second part, this is the OBA, outcome-based assessment. Okay, so it has two main parts. There's the multiple choice questions, and then if you pass that, then you go on to what they call OSCE, Objective Structured Clinical Exam, OSCE. All right, so when you pass that, if that's the second pathway, then you get an RN registration in Australia. There used to be a nurse bridging program, which was about 3 to 6 months, depending on the provider, but it's no longer available. So you just have to choose between these two, OBA or studying in Australia. RN skills assessment with ANMAC is fairly easy process. You have to make sure you pick the right nominated occupation based on your work experience. If you don't have work experience, it usually becomes a registered nurse NEC. And then English requirement, you already have satisfied that because you have an RN registration already. Work experience is not required. You can still get a positive skills assessment without working as a registered nurse. You need to get your certificate of good standing. You call it the COGS in the Philippines. This information about registered nurses that I've given you are just general information. Now, if you want specific advice on your application, it is best that you book in a consultation with me. If you want to check if you're eligible to migrate in Australia, please visit our website, www.bridgeaus.com.au, for a free initial assessment.